Hello, my name's Sian Howell. I'm a GP in North Southwark, and I'm going to talk for the next few minutes about managing type 2 diabetes in adults during the COVID pandemic. So everything I'm talking about today is available on the Clinical Effectiveness website and also on the South East London COVID support website. So when you go to the website, you will see there is the usual diabetes guide that we'd suggest you continue to use. And then if you scroll down the website a little bit, there's a COVID guidance for managing type 2 diabetes during COVID. So we'll go to the type 2 diabetes guidance and just take you through what we've included there. So if we go down a little bit, we can see there are three things that we need to think about if your patients with type 2 diabetes develop COVID. The first is the management of their COVID illness. We know that patients with diabetes have a high risk of complications, admissions, and even death from COVID infection. Follow the suspected or confirmed diagnosis of COVID guidance on the Clinical Effectiveness website, but have a low threshold to seek advice or even admission in this group. The second thing is the management of their diabetes during their COVID infection. And we're seeing very high sugars in patients with type 2 diabetes during a COVID infection. We're also seeing ketones ketoacidosis at a lower level of sugar than we would usually expect. So have a low threshold to check people's urine for ketones. If your patient's on insulin, they are likely to need higher doses. If they're not on insulin, they may need insulin during a COVID infection. Make sure that both you and your patients are aware of the sick day rules, which are included in the guide. And there's a useful link to the trend patient information on sick day rules, which I think is really helpful. Here we include the SAD-MAN mnemonic, reminding us which drugs we may want to consider stopping during a dehydrating illness, which includes common things like ACE inhibitors, diuretics, and metformin. So then the next thing to think about is patients post-COVID. So a lot of our patients have been admitted and had high insulin requirements during their infection. On discharge, they will get better and they will rapidly need to de-escalate those insulin requirements. Now, there is guidance for this on the South East London website and a link to that in the guide. And then the other thing to think of post-COVID infection is COVID can actually trigger diabetes even after a relatively mild illness. So have a low threshold to check your patients who've had a COVID infection for diabetes after their infection. Moving on now to thinking about the impact of the pandemic on our patients. So we know that a lot of patients have been shielding, they've been less mobile, and this has really impacted on both their well-being and consequently their diabetes control. We've also missed a lot of reviews in the last 6 months or so we really need to think about which patients we should be prioritising for review. Now, on your EMIS system are the clinical effectiveness prioritisation search, which for diabetes just looks at people who've had a very high HbA1c. If you want a more sophisticated search, you've also got the UCLP searches, which include high HbA1c, but also other morbidity and ethnicity, and divide patients into high, medium, and low risk. There's guidance here about how to find these searches, but if you need any extra help, ask your Federation facilitators or get in touch with us in the clinical effectiveness team. Then moving on to the diabetes review. Now, we'd like to do as much of this possibly remotely, either by telephone and or video, but you will need to still see some patients face to face, and some aspects of the review still need to be done face to face. So we would advise you to try and gather as much information before the review as possible. Both AccuRx and eConsult have a diabetes review you can send to your patients to gather as much information as possible. It may involve a telephone call from perhaps a healthcare assistant, and encourage your patients to do as much home monitoring as possible, including height, weight, glucose monitoring if that's something that they're doing. We got some guidance here linking you to doing remote reviews and also making sure you inform your patients what to do if they do get COVID. We'd encourage you to keep doing the 8 care processes. They are still incentivised, but even though not incentivised at the moment, we would encourage you to try and do the triple target as well, which is a blood pressure 140 over 80 or below, HbA1c 7.5% or below, and a cholesterol treated to a Q risk over 10% with a statin. Foot checks still need to be done face to face, and do these opportunistically when you can. So if you're seeing patients for a fluid jab, all clinicians should be looking to see if they need a foot check. Eye checks are up and running again, but on a slightly different timetable. So warn your patients their recall may be slightly different. Glucose monitoring, as we've mentioned, and ACE inhibitors are safe to use during the COVID pandemic. So moving on to the final piece of the guidance, it's just reminding you that there's lots of advice and support out there. Use Consultant Connect for urgent queries, or if you're considering admission, use the Community Diabetes Clinic for patients who are poorly controlled, and they will respond to queries if you email or phone them within a few days. There's also advice and guidance, and the at-home team if you're trying to maintain people at home to avoid a hospital admission. Diabetes UK have got lots of resources as well for clinicians and patients during the COVID pandemic. I hope this was helpful. Do let us know if we're missing anything or there's any other support we could offer you at Clinical Effectiveness Southwark. Thank you.